So my name's Simon Massoud and I'm a clinical psychologist based in Nottingham working with refugees and asylum seekers, and then I work part-time here at the clinical psychology department at the University of Leicester, and it's a bit of an odd role, but it's a short-term contract focused on diversity and establishing links with the local community here in Leicester, so between the course and the local community, and as part of that I'm responsible for putting on the refugee conference.
And as a clinical psychologist working with asylum seekers, what does that involve?
Gosh, well it involves loads actually, which is what I'm finding out. So I'm taking the lead for mental health services and for refugees and asylum seekers, and so how that works is that refugees and asylum seekers are generally referred via their GP to us, but what we generally find is that mental health services aren't able to really manage them very well, in the sense that they will often not attend appointments, or we don't have the correct address, or they don't language barriers on the telephone, so even getting people to an initial appointment is really difficult. So what my role does is work with local voluntary sector organisations like the Red Cross or Refugee Forum, and other trusts and charities that house destitute asylum seekers. And any links that I have with a refugee or asylum seeker via their GP, I make sure I get in touch with the voluntary sector as well. So sending out appointments or trying to contact the client, I do via those organisations. So we have almost like joined up working, so that it's not just a solitary mental health professional working with that person, because I think they don't fit into the criteria that's asked for within secondary or primary mental health care services, which is like being an independent, autonomous person and you just turn up at your appointment, and if you don't, then we take that as that's your free will and you don't want an appointment. Whereas I think in these cases, even from a starting point, they might not have even received the information about the appointment, because if they're destitute, they don't have an address. And so so I take a more joined up work, actually more collective approach with them.
And in the work that you are doing, especially with the clients that you have contact with, what are you finding?
Well, I think so. As well as trying to get ensuring that people's pathways into services are a bit smoother and that they do have a fair opportunity to access the support, I guess what I actually do is deliver psychological therapy then to refugees and asylum seekers. And I think it's a real mix, I guess. I feel like I'm finding my feet with them, really. So on some levels, like, I guess you can as a therapist feel really overwhelmed that they come with such traumatic stories or such immense loss, really, and especially if they're destitute, then they're people who are living off nothing, really, and if their applications have failed, then they're kind of in limbo and they don't have a sense of a future and what that might look like and what they might do. And a lot of psychological work is about restoring hope or having a sense of direction moving forward, however far forward, even if it's one little step, it's something to hold on to be hopeful about. So I think it really tests how you've been trained to work with people, really, and reevaluate what is the idea of moving forward or hope. And so I think for a lot of people, the work I end up doing is holding people where they are, really, and finding a way to bear with that and to live with that, and really day-to-day stuff, like just, so how are you going to get through each day, and then in spite of feeling just so powerless, how can we help you have some sense of power or control over your life? Because I think for a lot of people, they will say, well, you know, the government or the UK Border Agency, they have all the control and people have made these unfair decisions and I'm just powerless, like this is why I'm in this situation. And I think for any of us, if you feel you've been oppressed or you feel your choices have been limited or what your truth is, nobody else is accepting, I think that can just be so disempowering. And so often a lot of my work is, well, in this day, today that you have, where can we exercise some power? What can you do? How can you move out of a state of limbo? And I think that's a really tricky thing, because people say, well, there's nothing I can do because I don't know how long I'm here for, so I can't start anything. Whereas I think whatever you start, nobody can take that away from you. You still have that. Whether it gets finished or not is a whole different thing. And I think, but however far you get with it, that's yours to keep. And so I think sometimes it is a lot about reevaluating the idea of hope and an idea of moving forward. And then I also think the therapist offers the opportunity, very separate to all other professionals that they've been involved in that we're not here to judge their account in any way, whether it's true or false. It's just my absolute interest and advocacy is for that person. So whatever you tell me, I'm interested in the impact of it for you. Whether it's true or not, I'm not here to make those decisions. And whatever you say, I take as the truth of your experience, and that's what I deal with. So I think people find that really validating and really reassuring. And so they don't start off by telling you everything, because I think they think you're just another person who's going to pick holes in their account or question them in an unhelpful way for your sake. So I think for a lot of people, they get tired of this one-way conversation, like now that we're having, that you kind of like for your own purposes, you want to know things about them, or you're asking them. So I think it takes them a bit of time to realise that I've got no agenda, and whatever they want to talk about, I'm happy to talk about that. And then slowly I do find they start to tell me things about their past, and I don't think it's often that they want you to fix that or they want some kind of compensation for that, but I think it's like acknowledgement that this is part of their life story, and they just want somebody to hear that or maybe witness that. I'm not sure, but yeah, whereas I think a lot of professionals get put off thinking, well, how do I fix this for somebody who's had their whole family killed, or what do you say or do in response? But I don't think there is an expectation to say or do anything. I think it is often another person to hear that and to accept and acknowledge that this is what happened to me, because in reality they are coping with it, and they're managing it. You know, they're here today, and they're existing in spite of all these things happening. Yeah, but I don't know, I think, and some people come incredibly distressed, and I think they're distressed kind of each session, and yeah, I think that can be quite difficult, that you do wonder, and they wonder, when is this going to get easier? But I am really hopeful that it does get easier for people. And then some people come who, they're really well contained, and they've kind of accepted all these horrific things that have happened, and but they are at a loss. What now? What happens with my life now, really? Yeah.
And does, in your experience, in what you've seen,
Yeah.
and in the work that you've done, do you think the immigration and asylum system as it is in this country has an effect on the mental health of the clients that you're seeing?
I guess, like I said, I'm finding my feet, so I guess I'm learning from each person I see, like what the impact of these processes and systems on them are. So I don't know, like, I don't have a wholesale opinion on them, but I know, like, everybody who works in this sector does, and they find them incredibly unhelpful. So I don't think all these people who work in this area are wrong, but I guess what my interest has been, or my learning and understanding of them is through the people I see. And yes, I think it absolutely does. And I think just in the lack of flexibility, I think lack of accommodation of people, that I think in most settings, like where organisations or processes want a fixed system, a way of doing it, and that's just how you need to go through the system. And I think that's what I find incredibly frustrating. And so I, as a professional, I'm often having to make some kind of contact, either so one of my patients up in a detention centre, so trying to make contact with them, and and trying to get the detention centre to be more flexible in its systems, and it was so difficult. And I think, and I don't know if it is like these processes, they become more rigid because in reality they know what they're doing is not a good thing and how they're handling and dealing with people. And so in some ways, if you're very rigid and single-minded about it, you don't have to think anything more. But if you start to look at the needs of each person, if you start to apply an individual system, then you have to take on board the impact of what you're doing and where you need to alter things. So I think that's why they become even more fixed in their position and more rigid. And so, you know, my patient who ended up in the detention centre, when I went to visit him, he told me like how rude and dismissive the staff were in their tone, like they don't even speak to him as another human being. And when I told him that's exactly how they speak to him, in some ways that was really reassuring to him to know that this is across the board, that this is how they are. And I think they must have a need within themselves in order to deliver this system, to be a bit harsher, to be cut off. And I don't know, maybe it attracts certain types of personalities, I'm not sure. But I think just the lack of a recognition of individuality and individual people's experiences, and to be able to accommodate that is so frustrating. Yeah, that in order to do that, like they need special reports or professional input, or they need they ask for all this kind of evidence around it in order to create to do some things slightly differently for an individual. And so I find that really frustrating that within the system there's no account, or there's no opportunity or possibility to do things slightly differently.
How do you think the system can be improved? Are there ways that the system can be improved?
I'm not sure, like if I'm honest, I've not spent, that's not really been the end that I've focused on. I've not really focused on systems, like I've focused more on the individuals who bear the brunt of it or the impact of it. So, but yeah, I guess one of the things that seems to stand out is that they, in order to do something slightly differently or to be flexible, so for example, somebody who I'm seeing at the moment, she's 6-7 months pregnant and she has to get herself to Loughborough in order to register for the Home Office, the requirement every 2 weeks. She's not doing well with her pregnancy, she doesn't speak a word of English, and she has 3 other children to manage. So her getting there and back is just not really possible at all. And for them to consider to alter that to perhaps a monthly registration requires like so many different professional opinions and reports and letters to do that. And I think, well, if in the end you're going to listen to what we say and you are going to accept these, why don't you have that within the system to kind of evaluate or review each person that you're seeing? And I think, again, it goes back to these general ways of doing things, that they don't seem to have the capacity or willingness to do that, I guess. So I would ask for some of that. And same with the person who went into the detention centre. It's absolutely bonkers. Like they asked me to do a psychological report on the impact of the detention centre on him, and so that very clearly did increase his risk of self-harm and suicide being there. And then they accepted that, and then they released him from detention. Now they want me to do a report to say, well, how well he is. Well, he's bound to be well because he's no longer in the detention centre. But if you say he's well, then they'll put him back in the detention centre and then deport him. But it's just crazy, because what they don't seem to grasp is that his risk of suicide and self-harm is being in a sort of prison in detention. That's what does it. You're the trigger. But so just pinging him backwards and forwards out of this makes no sense. But because they're rigid on these processes, they don't actually sit analytically and think, oh, hang on, let's join up the dots, that now he's well, so we're going to put him back, then he's going to deteriorate, then we're going to have to take him out. But that's just what they will keep doing, and this makes no sense to me, really. I think the whole process sometimes feels very unthinking, that they're not very analytical, and I don't know if that is because they can't look at individual cases and they feel that they have to do things in a very boxed, large group, general approach. I'm not sure.
Are there things that you're seeing that are positive, uplifting?
In with the systems or around or other things?
With both the systems and the individuals that you're working with.
Oh, gosh, with the systems that's a bit more difficult. Are there positive things? I guess the good thing is so far everything I've said has been accepted. So I guess the good thing is they have accepted professional opinions, and so yeah, I'm glad there's no shutting that down. Apart from that, like I said, my experience of the systems is much more limited because I guess I'm seeing people who are in some way settled somewhere because they're accessing some level of mental health support. But in terms of the individuals, oh my gosh, yeah, absolutely. I think that's, I just think it's such interesting and different work, and it's, it really challenges you in lots of ways. I don't think it's the kind of work, well, I know lots of psychologists who work with refugees and asylum seekers, and they talk about doing lots of post-traumatic stress disorder work, PTSD work, and using specific models, and there's whole, I guess, approaches formulated around this kind of trauma work. But I kind of always sit there and think, I'm not sure I even get to deliver some kind of psychological model. I think a lot of the time it just challenges me as a human being that when you hear something like this, what do you do? And often I think it is the human response. I think that's the first thing you kind of draw on, and I think it's the primary and the most fundamental thing you draw on, I think, throughout that. And yeah, I think it just always challenges you that you see people who have, I wouldn't say it's not even resilience, but just they're managing things that you can't even begin to conceptualize. Like, you can't even understand being in that situation or what that might feel like to be feeling so vulnerable or threatened, and then to have gone through a process that doesn't take that on board or doesn't accept that. So I don't know, I feel like I'm always I think through it I learned to challenge myself and to think, I think just even to rethink the whole role as a therapist and what you do as a psychologist, and the idea of restoring a sense of self in someone, like how you do that. And I'm not sure that's so much about psychological models, because I think fundamentally there's not something psychologically wrong with these people. I don't think it's they've suddenly had a breakdown or something's not functioning very well and we need to use some kind of model to put everything back into place. I think it is a lot that they're coming from a social and political background or a cultural background where other human beings have treated them very poorly and things have been really difficult, and they've experienced like a side, I guess, of human beings that I don't normally get to see in my everyday life. And so now I think that kind of shatters your trust in people, or how you restore all of that and put it back together. So and I do think that the starting point is just how good a person you are in terms of making somebody feel that they can be at ease and comfortable with you and trust you, and that it's a conversation. I think a lot of the time it just starts with a conversation, and sometimes like some psychological stuff is helpful, but a lot of the time I think they're just very grateful to find that there can be a sense of peace with another person that they've not had for a while, I think, somewhere else.
Thank you very much.